Everyone. I'm Ellie Tahoney, and welcome to Research America's Alliance member webinar today. Thanks to all of you in the audience for joining us, and as always, for your partnership. We are so happy to have with us today Dr. Lainie Rutkow. Lainie is the Senior Advisor to the President of Johns Hopkins University on National Academic Strategy. She's also a Professor of Health Policy and Management in the Johns Hopkins Bloomberg School of Public Health. Lainie has played a key role in the Johns Hopkins Coronavirus Resource Center. I'm sure I don't have to introduce the Resource Center to you. It has been such a central force in both collaboration and just knowledge sharing that everyone needed to know across the globe as the pandemic took hold. We had the privilege of honoring Lainie and the center at our Advocacy Awards program on May 13th. And we're going to put a link to that short video on the JHU Center in the chat, as well as a link to the full awards program. And President Oprah Winfrey, Lester Holt, Renee Fleming, don't miss it. If you haven't had a chance to see it, it's very cool. But anyway, let me turn it to you, Lainie, now. We're so interested in hearing more about the center.
Thanks so much, Ellie. It is a real pleasure to be here today. And gosh, your awards program was absolutely incredible. I have watched it more than once, including with my team. So congratulations to all of you at Research America for such a phenomenal program. And speaking of my team at Johns Hopkins and with the Coronavirus Resource Center, we were so honored to receive one of those awards. And for a team that's been going now for 15 months strong, it just meant so much to us, especially from an organization that has the mission of Research America. So I'm going to share some slides because so much of the Coronavirus Resource Center relies on visuals. So I thought that would be helpful here. And you can see on this first slide, in that upper right-hand corner, that's what our homepage looks like. That's a screen capture. And the site, there's a lot of information on this slide, but I want to briefly talk about the origin story. So in January of 2020, Dr. Lauren Gardner, who's a faculty member in the Whiting School of Engineering at Johns Hopkins, she and a graduate student noticed that there was this virus spreading in the Wuhan region of China. And they, just the two of them, over the course of a weekend, put together a map, which is now well known as the Hopkins map, or some people call it the global map with the black background and the red dots. But that came together quickly over a weekend. They posted it, and it was picked up very quickly around the world. And what we came to realize over the course of a few weeks was that there was much more that we could be doing to provide accurate and timely information and data with expert analysis to the global community. So we decided to use that global map as the anchor and then build out what became the Coronavirus Resource Center around it. So about a month after that global map first hit the internet, we launched what we call in-house the CRC, the Coronavirus Resource Center. And we could have never guessed back in, I think it was March 5th, 2020, that the CRC officially debuted. We could have never guessed then the journey that it would take all of us on, and incredibly the impact that it would have, not just in the United States, but for countries throughout the world. Our team consists of subject matter experts, data scientists, a host of others. And for all of them, these are people who are very used to living in data on a day-to-day basis. But for all of them to be working on this site and knowing that behind every data point is a story and a person and a family was incredibly meaningful, and of course challenging, because it was all happening in real time. So fast forward to 16 months later, and I'm so pleased to say, and thanks in no small part to Research America, we are now an award-winning site. And the site does continue to be viewed as the definitive source for COVID-19 data. Over time, we've expanded. So with that global map, initially, we were looking at cases. The original red dots were looking at new cases of COVID, and then it moved on to deaths. And then we expanded as the pandemic itself evolved to sections of the site that focus on testing, on contact tracing, and then later on vaccines and hospitalizations. And we view ourselves as having several target audiences. The first one has always been the public. And we think about the public as folks that don't necessarily have any research training, but want access to accurate and timely information. And we keep that in mind for everything that we put up on the site. But we also know that we've become a resource for the policymaking community, for the media, for other researchers. And so we try to have pieces of the site that appeal to each of those audiences, but it's always the public that's top of mind for us. And we've used different, and I'll talk about this more in a moment, but we've used different types of communication strategies to get our information out. So there's the website itself, but then we've come up with various ways to extend that reach, and more on that in a moment. You can see on the bottom right-hand portion of this slide, that's a sample of one of our visualizations. And I just pulled it because I thought it's helpful to give a sense for something like this, which is showing hospitalization over time. Behind the scenes, this something like this is weeks in development, and there's a lot of workshopping with the group, figuring out, of course, are the data accurate, but then is this visualization going to be easy to interpret? Can you look at it, look at the labels, and quickly understand the information that it's meant to convey to you? And that process that I just described was a very shortened version, but we do that for every visualization that goes up on the site. Another thing that's been really rewarding is that our team spans Johns Hopkins University. It's truly a multidisciplinary effort. And you can see at the bottom of this slide, some of the parts of the university that are heavily involved. No surprise, the Bloomberg School of Public Health, the Centers for Civic Impact, which has deep expertise in public data and use of public data by governments, the Whiting School of Engineering, and then the Applied Physics Lab. This slide gives a sense of how the key milestones and how the site has unfolded. And it used to start at the very beginning back in March of 2020, but time continues to go on. So I've reduced it to more like a 7 or 8 month look. And you can see here that we truly have mirrored the trajectory of the pandemic, and that's been quite intentional. So for example, we did not launch a section of the site that focused on vaccines until we were at a point where it seemed like a COVID vaccine would indeed be a reality. And that's because one of our most key principles is focusing on data. So if it's an area where it was unclear what the data source would be or when it would be available, we've waited until the time feels right to debut a new portion of the site. So in October, we focused on the vaccine portion of the site, and it's since then dramatically expanded. In November, we added county level data to the site. And I feel like this pandemic has given all of us, not just researchers, but the general public, kind of a new relationship with data. And folks who may have never thought about it before, I think, realize now the importance not just of understanding the numbers at the federal level, but you want to understand what's happening in your state, or really your neighborhood. And that's where something like having access to easy to interpret county level data becomes critical. We also learned in November that Time had named the CRC one of the best inventions of 2020 and called us the go-to source for data. And you can imagine for a team of data-oriented people that was a tremendous honor. Then in December of 2020, we had a big update to our vaccine data. We also added hospitalization data, and that was something that we had wanted to have on the site for quite some time. We break it out both at the hospital level and at the ICU level. And I am so pleased to be speaking to all of you at a moment when hospitalization numbers are significantly on the decline. It's really refreshing to be talking about the CRC at a moment of optimism in the pandemic. Then in 2021, and I'll just hit a few of our key milestones here. The first was that we reached 1 billion with a B page views for the site. And that happened just after the new year in January. And that, this was such an incredible milestone and not something that in our wildest dreams, any of us would have foreseen when we put this site together. So it's an honor for the team, but it also gave us a real moment to pause and to just think about how many individuals around the world have turned to us to be their data source and to help them understand what's been unfolding in their households and in their communities. And it also, but we take that responsibility very, very seriously. The team has to operate on a 24/7 basis because that's how the site works. If one of the data feeds is off in the middle of the night, someone from our team is monitoring it and is awake to fix it. But we feel a tremendous sense of responsibility knowing that eyes around the globe are on us really at any given hour of the day. And then moving into spring of this year, so this takes us through the presence, we learned that the site had contributed to the Johns Hopkins University of Medicine being recognized as one of the top brands of 2021. And I pause on this one because this is a nice reminder, I think, that Hopkins before the pandemic, people would probably think about medicine or health or science. And we were incredibly fortunate with the CRC to be able to leverage that pre-existing public idea about Hopkins and then use it as a way to really engage with the public about data and the pandemic. And then, of course, Ellie, as you so nicely mentioned in your introduction, just recently we received the Meeting the Moment for Public Health Award from Research America. And again, I'm here on behalf of my team, but we all were really honored. So thank you again. This next slide just quickly shows what it means to learn that you're one of the top 10 brands in 2021. And there we are at number 8, but you can imagine that it gave us all a kick to see that we're up there with, Apple and Lego. As the parent of a young child, I can assure you that Lego is the far bigger deal in my house.
And ahead of Amazon.
Yeah. In terms of media coverage, and again, this is something I wanted to highlight because for us, it's the relationship to the general public, which often is conveyed through the media, that's been really critical to our team. So at this point, 16 or so months in, we have been mentioned over 2 million times in media and social media. And many of our experts have become fairly recognizable out there. So Jennifer Nuzzo is our lead epidemiologist for the site. Bill Moss is our lead vaccinologist. Beth Blauer is our data lead, and Brian Garibaldi is our clinician lead. And all of them have worked tirelessly to get their messages out and to always ensure that they're leading with the data and then providing their expert analysis as part of it. I wanted to also throw in what we view in-house as some of the highlights of the site. So because we're in the middle of the vaccine rollout right now, of course, we spend a lot of time thinking about, we call the different sections of the site the verticals. So the vaccine section in-house, we call it the vaccine vertical. And getting both the state and global vaccine data together was a full team effort. Some of you may remember that the rollout really took off at the end of 2020, which also coincided with end of year holidays. Our team worked 24/7 through those holidays to make sure that we could get vaccine rollout data up on the site as quickly as possible. We've hosted symposia on the site, and that's actually been a really nice feature of having this very public venue. When we see important events happening, we've been able to quickly post them and stream them to a site that routinely has several million eyes on it at any given moment. I also wanted to mention in our vaccine section that we have a blog that is updated on close to a weekly basis, where we have some of the biggest names in COVID vaccine development weighing in. And here again, these topics that the blog covers can feel quite technical. We work very hard to make them as accessible to the lay public as possible. So when I talked a moment ago about the different ways that we've approached communication, that's another one, by adding a blog. And we actually just launched another blog that I'll mention in a moment, but always with an eye towards accessibility and ease of interpretation. Another piece of the site that we think of as a highlight, and one that's been with us from almost the beginning, is one that we call the Testing Insights Initiative. And it feels like quite a long time ago now to us, and I'm sure for all of you, when COVID testing was top of mind, and we would hear about lines stretching around blocks, or a line of cars going out for a mile when folks were looking to get tested for COVID. And of course, people are still getting COVID tests now, but this part of the site was launched in the very early days of hearing about testing. And this is a nice example of how our team was able to look around the corner with testing. And what that meant was that Jennifer Nuzzo, our lead epidemiologist, came to us and said, "You're not hearing about it yet, but testing is going to be an explosive and controversial topic, because very soon everyone is going to want to understand who is being tested, who has access to testing, what do the testing numbers mean, what does percent positive mean, how do we interpret these data?" And she was absolutely right. And so we built out this portion of the site under her lead and guidance. I mentioned a moment ago that we've used the CRC for convening, of course, in this virtual environment where we're now all used to convening and conferencing on Zoom. A few of the highlights that we've been able to fold in, and all of these speak to pairing the data with expert guidance and analysis. We've had fireside chats with Dr. Anthony Fauci, and recently with Dr. Rochelle Walensky. We've hosted symposia that bring the latest information about COVID from a variety of perspectives on the site. Every Friday, we do a live briefing from 12 to 12:30. I moderate those briefings, and we have a group of our experts. It's a rotating group, so it's different every week, but we have a group of our experts come, provide some thoughts for where we are that week, and then we take questions in real time. And because I'm the one who sees the unfiltered questions coming in, I know that folks really appreciate that opportunity to engage directly with our team. We have also had fun communication opportunities, like a panel at South by Southwest earlier this year. And I thought that I would conclude with some of our latest developments. And this is pretty hot off the press stuff. This is actually the first time in a presentation that I'm speaking about this. We launched last week a new piece of the site that we call the Pandemic Data Initiative. And I want to quickly tell you what the thinking here is. We've seen so much about data, challenges related to data. Is data accessible? Is it easy to understand? Is it accurate? And we talk about this within our team all the time, but we also know that the challenges that we're seeing are not going to go away. It's inevitable that there will be another public health emergency. I hope it's not a pandemic, but there's always something that's just around the corner. And all of the lessons that we've learned about data can be applied to whatever is coming next. And so we launched this Pandemic Data Initiative, which also has a weekly blog as part of it. That's what you're seeing at the bottom of the image here. We launched it because we want to bring those conversations into the public domain. And it's our hope that part of the legacy of the CRC is contributing to changing the public's relationship about data. And while it's all about the pandemic right now, as I said a moment ago, that relationship between the public and data needs to be there regardless of the crisis of the day. I'll end by mentioning that we do have a weekly subscription newsletter. This is another way that we've approached being able to engage with the public. It's very user-friendly, easy to digest information, and it comes out on Mondays. So I'll end there, but I would be remiss if I didn't also thank our funders who have made all of this possible, and that's Bloomberg Philanthropies and the Stavros Niarchos Foundation. And I'll stop sharing my slides now.
Lainie, thank you so much. I have many questions, but we'll turn very quickly to questions from the audience. I just want to ask, one thing, just an observation, you think about that 1 billion, it is hard to imagine what the multiplier is on that. I just think within my own family, a piece of data that runs through and then shows up on Facebook, but through the media, through conversations, I just can't even imagine how many people you've reached and the influence there. One question, you mentioned that one way that you are, the site is going to contribute, or the experts around the site is going to contribute to post-pandemic thinking. How can we improve? Has to do with data itself. Mm-hmm. But how about, the insights gleaned from your data, just the variation across states would be, something to kind of be concerned about going forward the next time. For example, that kind of thing. Is the JHU Resource Center providing data that, a diversity of researchers around the states and the globe are using to kind of channel those types of insights, and particularly, I guess, health services researchers? Or is JHU doing that themselves to contribute to things like the health committee's work on pandemic preparedness modernization?
That's such an important question, and the answer is it's both, Ellie. So of course we're doing additional work in-house, but we felt from the beginning with the site that if we were making the data public, we also had to make the accessibility public. So on the back end of the site, we have a GitHub, and researchers around the world go into it on a daily basis. And we also have a team that closely monitors the GitHub. We are anxious to be responsive when folks have questions, concerns, and I have people reaching out to me personally on a daily basis, but we also have a dedicated group just to make sure that we're being responsive to what the research community is asking about.
Let me ask another question. This one is not pretty particularly, but I was recently in North Carolina and was talking to a person in a grocery store who was telling me that the data around COVID had been so inflated, and that the data about vaccine injuries had been underestimated, that there was an agenda, Mm-hmm. And I'm wondering, did JHU were you able to kind of stay separate from that tension around, is the data accurate? Is it being used for a political purpose? Those kind of concerns that folks had, some in society had about data around COVID.
Sure, and it's true. We're in a moment where misinformation and disinformation is rampant, and I think it's only gotten worse with the vaccine rollout. So, a few answers to your question, Ellie. One is that our experts are routinely in the media, and part of what they're doing is trying to provide the most accurate and timely interpretation of the data, and to provide truth and reassurance about what is actually going on. We also will, on a pretty routine basis, have policymakers at every level of government, both within the United States, but also from countries throughout the world, reach out to us to talk about data and to clarify and to make, and the reason is that they too want to make sure that we're pulling the most accurate data and conveying it in a way that is easy to understand. But perhaps the most telling answer that I can give to your question is that when we do our live briefings on Fridays, we have folks that submit challenging questions along the lines of what you were getting at in your own question about folks that you spoke with when you were in North Carolina. And it's our feeling that the best service we can provide is to answer those questions, but to do it with always grounded in the data and to make truth accessible.
And you know what I think, I'm sure you've thought of this, I had not, is that another thing that magnifies the value of JHU's Resource Center is the level of distrust that would have been the case had there not been a third party that had no political, that couldn't be accused of having a political agenda. I mean, maybe there are ways through funding stream, who knows, people can find ways, but generally independent third party.
I do appreciate what you're saying, and yes, I think we have benefited from being viewed as a neutral academic party, and we've tried hard to always make clear on the site that there's no agenda. Our only agenda is to provide accurate data and pair it with expert analysis.
Right, and I imagine that has benefited the response, vaccine uptake, every part of this testing in a myriad ways. Let me stop, although I can go on forever, as everyone knows. Terry, do you have any questions for us?
Yes, and just a reminder to folks watching, you can go ahead and put those in the Q&A box. One question that came in, you mentioned early on about this, and Ellie touched on this a little, but like, can you talk a little bit more about this new relationship with data, and how are people, like, has this changed the way people are going to think about data forever? Like, is this something that's going to be with us for a long time? I know this is kind of a broad question, but I'm curious what your take is.
I think that the pandemic has changed the way that the public thinks about data. Now, will we all be as obsessed with data as we are in this moment? Probably not. Well, I mean, maybe my team will be, but they're a very specific group. But in general, I think that people have gotten used to the idea that if they want to know what's going on in their community, and COVID is obviously the example that's on all of our minds right now, they can go online and look at the data and make decisions for themselves and their family, that have grounding, that aren't just based on what a friend told them. So I think that knowledge that data are out there and that they can be used by the public, that you don't need to have a research degree to access this information or to understand it, that piece I think will not go away. But as I said, I don't expect, and I hope that as we move forward, we're not all glued to our computers looking for the latest disease data. But Terry, I guess one other piece that I would add to that is I also think that we've developed as a society a little bit of a shared vocabulary that's related to data. And I don't know if this will be with us forever, but I bet both of you have had the same experience, that in casual conversation, you start using phrases that you never would have before, like right, like mortality rate or test positivity or so it's also, just the nature of living through this pandemic has made all of us smarter about data.
Yeah, absolutely. And it's just so much more personal now for people, right? Like, this is something that they're thinking about, and how do they're literally using this data every day as they make their choices and decide what risks they want to take.
Lainie,
Another question.
Hold on. Do you have time for one more question? I realize that we have a hard stop with you at 2:30, and I wasn't cognizant of the time.
Let's do another question.
We'll do one more. Okay. Well, so speaking of the future, you probably learned a lot about how to pull together data from different streams and build maps and take large quantities of data together very quickly. Are those tools or processes things that maybe the other folks in the university can use in the future?
Yes. So the way that, and I'm going to give a short, not technical answer, but the algorithms that are behind the data. So at any moment, there are about 260 sources that feed into different parts of the site. But there have been a lot of lessons learned in the building of that behind the scenes data infrastructure that I think will be of great benefit to others in the university, but hopefully also to others throughout the world.
Wonderful.
Well, it's nice. I always say there's no silver linings. There's really nothing good about a pandemic, but the idea that it can, maybe move data analytics and data analysis and forward in ways that maybe we didn't have before is at least something. I'll hand it back to you, Ellie.
Sure. Well, I made a promise, Lainie. If we have questions, I see that we do. Do you mind, would I be able to shoot them to you and get back to the folks who asked the questions?
Oh, I hope that you will. Please
Okay.
do. And I will get back to you quickly.
Well, thank you so much. I have a little bit of housekeeping for you all in terms of future meetings, but I know I need to let Lainie go. We could have, talked forever.
Well, it's
so
been
much.
a real pleasure. Thank you so much for the opportunity.
Oh, absolutely. We'll see you soon. I just wanted to let you all know next week, yes, we have Dr. Josh Gordon. And, NIMH just announced some new research they're going to be doing on COVID-19 and mental health issues in adolescents. So I think there's a lot to talk about next week with Dr. Gordon. So I hope you'll join us. Looking ahead, we're going to be doing a roundtable discussion about ARPA-H. We'd love to get to convene around this topic just to get your input and thoughts that we can help share forward to members of Congress and to the administration. So that's coming up. And oh gosh, I know more is coming up, but of course I can't remember at the moment. But thank you again for your partnership. If your organization is not an Alliance member, come with. We'd love to have you join us. The strength of our Alliance, the strength of our advocacy depends on you and depends on the diversity, the reach of our Alliance. And so please consider joining us. Katie Good from our team is always standing ready to provide more information, and email me and I'll connect you. So with that, we'll say goodbye and thanks again for joining us.